Hey, hello everyone. Welcome to Blumberr Healthcare Podcast, where we explore the journeys and insights of healthcare professionals who have been the backbone for our medical ecosystem. Today we have with us Dr. Parth Vaghela, a cardiothoracic and vascular surgeon, a specialty that deals with some of the most complex and life-saving procedures involving heart. Dr. Parth comes from a family of doctors and where the spirit of serving and helping humankind has been ingrained to him from childhood itself. Right? During his MBBS, he had a fight whether he has to take up between heart and brain and heart one. And so we have with us the great Dr. Parth Vaghela, who has been a cardiovascular surgeon, and he has been practicing for the last 21 years. He has done his MS in general surgery, and he did a super specialty in cardiothoracic and vascular surgery, and he completed that in 2018. All right. Now, in his current practice, he manages a very busy schedule, operating at least 2 or 3 patients on a daily basis. And among the most challenging, I think you had mentioned that you had treated post-traumatic cardiac injuries and aortic injuries too. Right. And today we will explore your journey and how you took up and the different situations you handled everything. Thank you so much, Doctor, for joining us today. Welcome on board. So, before we start, could you please tell us more about yourself?
Thank you.
A little about your.
Thank you, madam, for having me. Basically, I'm Dr. Parth Vaghela. I started my medical career in 2005 when I took the admission in MBBS, which is the basic requirement to become a medical graduate in India. During my MBBS time, there are multiple rotationship where we has to go to surgery, medical, every other department to see which kind of patients are coming, how they are being treated. And during my surgical rotationship in first of my MBBS, I got to know regarding surgery in detail because I was more inclined toward the surgical field. And then I got to know regarding the cardiac and neuro, means the heart and the brain. And I thought both the things are very fascinating for myself, and then I wanted to explore more. For that, I wanted to reach any super specialty. I had to undergo basic post-graduation, which is MS General Surgery. So I completed that afterwards in 2012 to 2015. And during that, I got more chances of exploring myself into the neurological and cardiological and every other aspects of surgery.
Okay.
And there I decided and inclined towards the cardiac, being a cardiac surgeon.
Okay.
So post my PG, I wanted to be a cardiac surgeon, and I'm fortunate enough to get that degree in super specialty.
So, between heart and brain, you said heart won. How did heart win for yourself? I mean, what were the factors that made
Primarily, any medical graduate who wants to treat a person wants to see patient happy, patient going home with happy faces, and any tree you treat, whether it is a skin disease, whether it is a gynecological issue, whether it is a opthal, ENT, any kind of issue, once you want to see that it is resolved and patients are happy. So during our general surgery term, every surgeon, whosoever is undergoing post graduation, has to go other departments like neurosurgery, cardiac surgery, urosurgery, plastic surgery. So we also had the same rotation. And during that time, I was fortunate enough to handle and to operate and to assist many neurological and cardiothoracic surgeries also.
Oh, okay.
But in neurological, in brain main. But after surgery also, there are more chances of being them in coma due to the devastating effect of that disease. So if you are treating disease, then also you are not able to make a person happy or make them totally fine and making them go home after a few days.
Okay.
Whether in cardiac is also dynamic state, and it is also life-changing, life-driven, and life-consuming medical branch. But in cardiac, you see people after getting treated, they go home happily. The person or himself are walking. So that drove me more to that I want post-operative outcomes as well. Cardiac, I was more inclined primarily because it fascinated me.
Understood. So, because of fascination and your inclination to see happy faces, you chose heart over brain.
You want to see that the patient should be happy,
Yeah.
at least, and the relatives also. Everyone wants happiness in life.
True.
So after that, I want whenever patient is going home, he or she should not in any kind of morbid or any disability state, which neurological issues leads you to, because it has its own pathologies, and that is also very defined that neurological issue is not over the time treatable on the spot diseases.
During the cardiac surgery itself, it's like it's the most demanding specialties also in medicine, right? So what
Right.
kept you motivated to pursue this? Like, it's not easy. It's like you did your post graduation in general surgery, and then you took up cardiac surgery, cardiothoracic and
Cardiothoracic and vascular surgery.
surgery. And how did you handle, and also you have your family, your day-to-day life happening. How did you balance all this, and what kept you motivated in pursuing this difficult subject as such?
Primarily, I wasn't forced to become a cardiothoracic and vascular surgeon.
Correct.
Not societal pressure, not financial pressure, not my pressure. I just wanted to be, and that drove me forward, and that it is still keeping me getting ahead in my life. That I am going to help a family, a generation, a person. So it is my personal motivation that I wanted to be a cardiac surgeon, and I primarily and always believe whichever things we are doing, if we are loving that thing, we will be continuing that thing for a longer amount of time or till the time we are alive. So that is a basic motto: love what you do what you love.
So
In my case, there is no pressure from anything, anywhere, that I need to become this so that I can earn more, or so that I can be that, get that reputation, or have that kind of lifestyle. Nothing. It is a very demanding, it is a very practical, and it is the, I guess, most demanding, because cardiac is a very dynamic structure. Heart, it pumps every second. So we are dealing with that.
yeah.
So it is in all over the world, whosoever is a cardiothoracic and vascular surgeon, all are doing that precious work of handling the heart. So it is a very demanding thing, but at this with great power comes great responsibility, just like that. So we have to do that, because I love to do that. So I am able to manage everything, because my family is also, as I told earlier, and you also mentioned that family is from doctor background. So everybody understands what kind of nature cardiothoracic surgeon has to face in their life, and what kind of surgeries, and how long the surgery is going to go, how much dedication towards the work he requires. So that understanding comes from the family. So not me. The family part takes a major role in any cardiac vascular surgeon to handle a life.
Understood. Very nicely said, sir. So, you have been practicing medicine, like you have started your MBBS journey in 2005, and you became a super specialist also, right? When you look at your career so far, what has been your turning point in your careers?
Turning point was first. My general surgery rotation shift, and when I saw cardiac thing is very dynamic, people are scared to touch, people are scared to treat, just because it is cardiac diseases are so vast and so complex, and it requires very demanding surgery, demanding outcome, demanding rehabilitation, demanding physiotherapy. So whichever is easy is acceptable to anybody, but whichever is difficult requires
A lot of hard
some
work.
talent, some skill.
Yeah.
Yes, hard work is the main line. So it is it applies to you, who applies to me, it applies to every single person.
True.
So hard work is nobody can run from hard work. If anybody is running from the hard work, they are running just in vain. So the turning point, as you asked, it was my third first where I decided I wanted to be a cardiac surgeon.
Amazing. Okay. So it is your internal strength and fight that made you choose becoming a cardiac surgeon, and you stick to it. So that's nice.
Right. Well, I made my hard work, but I was lucky and fortunate enough, and God has been kind to me that He gave me the path very rightly. Otherwise, there are people who become a cardiac surgeon at a very later stage because they have to give their exams and we have to prepare more, we have to be that vigilant, we have to fight for the survival in the market. So God has been very kind that I was able to crack the my MS general surgery and time, and then back to back MBBS, MS, and then MCH happened in my life. So I am able to sit in front of you at this moment and this age of my life.
I'm glad. So, doctor, before I proceed, I have one question. Maybe it's for my own knowledge or maybe for the listeners also. So, 5 years goes into studying MBBS. After that, 3 years of doing your master's in general surgery, which you completed in 2015. That is 2011. You would have finished your MBBS and immediately you joined your post graduation.
MBBS is 5.5 years.
5.5. Okay.
It is not a 5 year course.
Okay.
So mainly MBBS completes by 4.5 years, and 1 year internship is mandatory for everybody.
Okay.
So it is a 5.5 year course.
Okay.
Then you get into the post graduation. Any post graduation which is NMC right now, MCI and NMC recognized is 3 years basically.
Okay.
And there is degree course. I am talking about degree courses. There are so many courses, diploma, PNB, other 6 years courses. But I am not talking about. I am talking about mainline things, which is been recognized and which is been populated in everywhere.
Yeah.
So 5.5 year course in MBBS, then 3 year in post graduation, which is general surgery for me, and then again a 3 year MCH. This is the super specialty degree. That is 3 year course in super specialty MCH. CTVS for me. So this is the pattern.
So that is like 5.5 plus 6 years. That's like 12 years in study.
12 year grinding is mandatory for everybody. That becomes 18 years grinding, 20 years. It totally depends on the time, situation, and the surrounding of a person.
Understood. So you people have been studying so much, grinding so much within India. Now, these are like your degrees, that the super specialty that you have done and the number of years of experience you have gained. Is this recognized across the world also?
I can't say across the world because every single country has their own educational policy. You might be hearing that India is adopting the national education policy to the another level.
Correct.
Just to be competitive enough with the other world countries. So I can't say that I am eligible to every country, but I can just say that I am eligible to become a cardiac surgeon in US, UK, any country after giving their exams also, because they need to have, we need to crack that exam.
Right.
Also,
right.
entry exams for them to know whether this person is having that actual degree or not, because fakeness is propagating everywhere these days.
Correct.
So many countries allow, many countries has their potential to make any Indian doctor with that Indian degree super specialist or specialist in their country, but not all the countries. So I can't say in world, but there are a list of countries.
So let's say in US or UK, you gave their, as per their compliance, they conduct a medical examination. Now that you are super specialized,
Right.
there is one exam that you need to take, and you are free to take consultations even from patients in UK and US.
Right. After competing and after clearing those exams, whatever they are taking, every country has different named exams.
Correct.
We are able to go into that hospital and being a consultant and everything.
Awesome. That's nice. So now coming to your practice as a cardiovascular surgeon, right? What is your day like on a typical?
You can directly say CTVS.
CTVS. Okay, CTVS.
No need to no. CTVS would be better.
Okay. So as a CTVS, what is your day like? On a daily basis, you said 2 to 3 surgeries every day. How do you handle? What is your typical day like?
Madam, what I said, 2 to 3 days surgeries per day, that is a dynamic thing. Primarily, when I was just pass out or in my MCH, we used to do 8 surgeries a day.
Oh, 8?
Then
Oh,
8.
okay.
8 cardiac surgeries, then other surgeries are different, just like vascular surgeries, thoracic surgeries, as the CTVS term goes. But as I came to the consultant, becoming consultant, associate consultant, and independent consultant, and now HOD in a medical college at present. So a single person has to do many other things. Just like as you are asking, what my day like. So daily routine, after waking up, daily routine, and then go to hospital. I won't be precising about my personal life, but mainly professional life. Once I reach hospital, then my OPD is running. So patient in outpatients department, I need to see that I see whosoever requires surgery, I explain them, guide the investigations. If I have kept any surgery over on that particular day, so I will go to surgery after completing surgery. Again, I come to the outpatient department to is there any patient or not, and if any patient is there, I need to see those patients. And after completing everything, I come back home. And during hospital, there are multiple management thing, wo thing, market thing. So many things happens. But IPD, indoor patients are being managed on a daily basis. Outdoor patients are managed by daily basis. Surgery is managed by daily basis. So everything goes hand by hand.
So typically, how long is your day in a hospital? Considering you are doing so many things.
From morning, it just starts from morning 7:30 to 8 to night. It is a 12-hour job like thing. It takes around 8 to 9 every day. Sometimes it takes around 12 also. Yesterday I was free around 1 a.m. at night.
Sorry, 1:30 p.m. a.m.
1 a.m. at night yesterday.
Okay. So when you do a surgery, because if let's say you are doing a very hard, difficult cardiac surgery, and what kind of preparation do you do in your mind before you go into a surgery?
Focus. Which surgery I am going, what patient requires, what I need to do, and thinking regarding what if anything goes wrong, what can be the other options or alternatives.
Okay.
Because every single person having the same disease has different outcomes. In cardiac surgery, mainly. Same disease doesn't have the same outcome. Because every structure, every individual is different, every response is different towards the surgery, towards the medications, towards the recovery. So we need to be focused enough to think what we are going to do. If it goes well, everything is okay. If it doesn't go well, so what can be done if it doesn't go well to give him or her a better life.
Understood. So, typically given, like you have been such an experienced person, how you also will be present to give answers to the patient's relatives?
Right.
Okay.
I believe in that, whosoever the patient and relatives has met me primarily in outpatient department. So I should be meeting each and every person every single day if it is possible.
Okay.
Because I am also human. But I meet till now I have kept that record that I meet every single patient and his or her relatives to explain what is going on at present.
Okay, that's really sweet. Not everybody will have that patience to be ready enough to face the relatives of the patients when things go wrong, right? That's really nice.
But we have to take that primarily. Before taking surgery, we explain everything to the patient and relatives because nothing is in our hand.
Correct.
Just like I said, as a human being, I can't control life of anybody.
True.
I can just make it easier. So we explain everything And if anything is not going properly, we need to explain the same thing, that this is the thing, we are trying our best, but these things are not working. So we are trying to try different things in a different manner.
Correct.
But what will work, how it will work, and how long it will work, and how the body will respond,
It's
that
not,
is totally an individual thing.
it's not in our hands. And
Yeah.
okay. So when we had our earlier discussions, you had mentioned that post-traumatic cardiac injuries and aortic injuries are among the most challenging cases for you. Could you explain a little
Yes.
what they are and why you think that these cases are very complex?
Actually, CTVS has every case is very challenging, primarily. Why I said this? Because in post-traumatic, nobody knows what kind of trauma, how much penetration by that trauma, and how much defect or how much injury it has occurred due to trauma in the cardiac setup. Because
Understood.
heart is made up of 4 chambers and multiple vessels. Which vessel is torn, which vessel is injured, that nobody knows. And in trauma patients, in cardiac trauma or aortic trauma patients, nobody has that much amount of time to get under the every investigation and take the patient to the operating theatre.
Time is valuable.
So it is a double blind study primarily, because we just know that the patient is having that trauma and he or she has cardiac or aortic, matlab the main vessel coming from the heart to supply the body, has any injury. If patient is stable, we get into the investigations and we get to know in detail, but not every time. If the disease or trauma is very severe, we need to directly take the person into the operation theatre without knowing also that which kind of trauma it would come out when we will operate.
Understood.
On the same time, once we are operating, we need to take that fraction of second decisions, what is there and how we will treat that. So that is adrenaline rush.
So how do you
And
take
that
those?
is
Sorry to interrupt. Go ahead, doctor.
so that takes a little bit of courage, mind, and everything out of you, because it is not a elective case. For the planned case, it is not a planned case. It comes in an emergency situation. So that takes a lot of out of you. That's why I told that cardiac injury and aortic injury cases are much tricky.
I mean, do you anytime doing such kind of tricky cases or doing regular surgeries also? Do you feel that it is a great responsibility on yourself as a surgeon, and does that pump you, or how does you yourself become a strength to make it happen? What's the kind
I'm not alone. Cardiac surgeon can't be the alone person who can treat a patient in cardiac surgery.
Okay.
Cardiac surgery is a teamwork, and alone I can't do anything. Nobody can. Not a single person can treat a patient. Only everybody needs somebody. A cardiac surgery runs on a team that requires a minimum of 9 people and maximum of indefinite people to make things easier happen. So as you asked how I prepare, I don't prepare, because emergency is not prepare thing. Preparation can be done for the knowing thing, that I am going for a surgery which is planned tomorrow, and I can plan out that I will go this. The person will do this, I will do this, and we will get done this amount of things. But emergency comes and we need to take a fraction of second decisions, fraction of second answers to the. Okay, we need to explain to relatives also, because India is not that educational market. So we have to make them understand which kind of situation is they are in, and what they should be expecting out of us or out of the hospital or out of his or her relative.
Right. So, like you said, there is a team that helps you build this. Conduct a surgery. Some from perfusionists,
Right.
anesthesists, everybody, right? Like, how important do you think it is important to consult them or collaborate with them in a dynamic way during the surgery, and how do you do it?
It is a mainstay. We don't have to collaborate or we don't have to think regarding it. If team is there, then and then the surgery is able to go ahead. If any missing link is there, then nobody can do the surgery or nobody should do the surgery.
Got it.
It is not just a cardiac surgical person oriented thing. Yes, you can say that a major share of a surgery is for the cardiac surgeon, but without perfusionist, without cardiac anesthetist, without cardiologist, without even scrub nurses, without physician assistant, or without post-operative physiotherapist, without post-operative intensivist, without post-operative ICU nurses, or without post-operative anesthesia technician or ICU technician, nothing can go ahead. So there is a lot of big team required for a single patient to go in and come out of OT.
So India has been a specialist in cardiosurgeries in the recent times, right? In the last 5 to 6 years, if we look at news, a lot of surgeries have taken place in India, complex ones, and India has also achieved to be the lowest cost-wise. India has been the best in terms of cardiac surgery. How do you guys achieve that? I mean, if you say so many people, so many instruments, and the kind of collaboration you are talking about, I believe it will definitely cost a bomb, but India has achieved somehow the lowest cost possible for cardiac surgery. How did you people arrive at that?
As you know, India finds its own way to tackle anything in a less costly manner. Whether it is a cardiac surgery or whether it is any damn business, or because we people are making things in cost effective manner, but effective. It is not just cost cutting, it is the effective manner.
True.
So as you rightly said that India is having that upper edge recently to have that cost effectiveness in cardiac surgery. That is totally right. And but India is ahead of cardiac surgery. I can't say that because every country has their own identifications. Just like Germany, US are there doing tremendous amount of surgeries, complex ones, super complex ones, because they have that kind of instruments and that kind of equipments with them. In India, we have the tendency, once we get to know that this instrument or equipment is very essential for anything, we try to make in a very local manner, so it is cost effective.
Okay.
So by that manner, over the period of time, since 1975 till the day we are talking, it has come to this amount or this range that everybody is able to afford now.
So from whatever the last few decades, India has been working on producing instruments that can be cost effective and also be locally made.
Not just instruments, people, instruments, equipments, and every single thing which makes the harmony working.
Okay, understood. So we have seen so much of improvement in cardiac surgery itself, and so much of innovations has happened. Technology has become part of it. Robotics has become part of it. The procedures, and we cannot separate robotics from anymore from surgeries, I believe. Right? And how do you think the next decade is going to evolve in the field of cardio in CTVS?
Everything is addressed with AI and robotics or automation. As I say. So next decade or next future will be dependent on AI, but nobody can or AI replace humans.
Right.
On the name of skill. On the name of knowledge, they can replace. But on the name of skill, human instincts are different from AI. And just like robot can help. Robot can't replace.
Correct.
Because we are not treating machines, we are not tightening the screws, we are not delivering food. So these can be done by robot, but somewhere robot needs instruction, what to be done, what not to be done. The primary things are that what not to be done is decided by our mind only.
True.
What to be done can be taught. AI and automation will be the next future. And you can't remove robots out of surgery because that is the mainstay going ahead, but it will help. It will definitely help.
So you're saying AI and robotics can be a tool that is friendly for the doctor to ease his job, rather than just considering they're going to replace us. And I totally agree with you.
Yes, it is just a dictionary. As you don't know the meaning, you find out in dictionary and you get them the answer. But you can't make a new word out of it. Na?
Right.
In dictionary, you can't make a new word.
Right. Before I proceed, I forgot to ask you one question. You also mentioned that you are head of the department in one of the colleges,
Yes.
right, in Gujarat. So, that means you're also teaching there. So, how do you handle
Yes.
that one? Like, that is a huge responsibility. Handling your teaching staff and also teaching as one of how does that go hand in hand with your everyday?
It goes in a flow in everyday manner because every surgical person has to go like that only. The day starts. Anybody who is interested, just like me, when I was studying, as I told you that we had rotationship and I had to go to the surgery. So anybody who is teaching under me will be with me during OT, after OT, pre-operative, post-operative. So they are learning that how the patient is being managed and how the things are going on. And this is no difference in any surgical branches. It applies to everybody.
Okay, it's
So
not theoretical.
whoever is teaching, their theoretical comes not only theoretical. Surgery is not only theoretical part. It is 70% practical part, 30% theory part.
Okay.
Because theory makes you know about the thing, anatomy and everything. But to handle how to incise the skin and how to suture the skin, that is a practical thing. You can't learn by reading that thing. You can learn complications. You can learn by what anatomy comes under if you do that, if you don't do that. So surgical branch requires both practicality and theory.
Got it. Okay. Now coming to the public health that we have. So what are the most common health-related problems that people ignore until it becomes serious?
You might be hearing and going across the news is that heart attack. These days, heart attacks are much more in younger age, in any age. So people are aware of heart attack term. They are aware of chest pain also, but India is an adjusting country. People don't come to the doctor very early. They come whenever they feel like this is the last resort of their life. So the disease has advanced so much in India. Then we take a complex disease. Otherwise, if the person would have come 20 years earlier, the disease would have easy to manage, easy to get the results done. So in India, the Gujarati इन्हें बोलते हैं सहन शक्ति वो ज़्यादा है. That is more in Indian people because of the cost only. The main factor is cost in India. Now, post all the PMJY Yojana, we should be thankful enough to government that they implemented the PMJY Yojana, Ayushman Bharat Yojana. You might be heard.
Yes.
So because of that, the rural population are able to undergo this complex or this mega super major surgeries without paying any money or without paying any penny. That is a good thing. That's why the cases are coming up earlier. They are able to get the consultations better and having that treatment earlier in their life. In rural people also.
Okay. So the heart attacks in younger generation, like before 25 years also people are getting heart attacks right now. You're saying that like 5 years before, if they had observed certain characteristics, they might have been able to help themselves. What are the symptoms that a person can identify that maybe something is wrong, seriously wrong?
Primarily, what I think and what I have observed, there are many factors, lifestyle changes, bungee eating or the food habits, everything. But main thing, what has evolved over the time or over the Gen Z period or millennial period, stress.
Okay.
Stress has inducted since childhood. That was not in before 2000 era. The time, stress of performing, to stress of achieving, to stress of earning, to stress of having, to stress of not having. So because everybody is having that same diet, same food habits, lifestyle. Well, everybody wants to achieve that, or everybody wants either have that or I want to achieve that. And everybody talks about those things. That is also right. I'm not saying that is not right. But stress plays a very big role in having that disease earlier. Because in 25 years, your body is just coming out of your teenage and evolution.
Correct.
And if you are getting that diseases, so that might be due to the any other congenital means genetic factors or your stress taking ability.
So to help people who are taking so much of stress early on, right? What kind of activities they can do, or what should they do to avoid such stress, which can help them reduce the risk of these diseases?
Primarily, know which kind of stress you are in, or why are you stressing those stress upon you? Because there are so many remedies, there are so many people are talking about whether related to cardiac, non-related to cardiac surgeon, cardiologist, or whosoever will talk about cardiac thing, early age heart attack and everything. But thing is that we need to come to the conclusion, a solution. To diagnose a thing after it has went past, it doesn't go to help us. So for me, we need to find out what you are stressing about. Everybody has their individual stress in life.
True.
And lifestyle changes is required, regular exercise is required, avoid oily and spicy food, everything applies. That everybody knows. Even a layman knows these days. But thing is that after avoiding smoking, after avoiding alcohol, after avoiding everything, still people are having that disease and still patients are having same kind of outcomes and diseases. So what is another thing which should be changed or modified? So thinking process, less stressful life, competition mode, these are the things. We can't escape that because life has just become that. So you are also in some kind of stress. I would be also in some kind of stress, but that is part of life and we have to go through it.
Understood. So doctor, in your career, can you remember any one case of yours which has actually jolted you or moved you to a great extent, and you have been able to contribute it to that case?
As I said earlier, madam, CTVS is a very dynamic brand, and so every single day you have every different kind of experiences within the same disease. So there are plenty of cases which me, after this much of experience, I have so many cases. So whosoever is having that my triple, fourth time experience would be the best person to guide us. But for me, there was an experience which I can share that a patient of 85-year-old old gentleman who happens to be having that coronary artery disease, means blockage in the heart, and with one valve of the heart was defective, so we had to change that, and we did it. Surgery went uneventful, but due to some reason his body was not reacting to the medication, so we had to put him on IBP named instrument, intra-aortic balloon pressure. And for 7 days stretch he was not showing any signs of recovery, and the medications he was requiring was getting more and more, and every kind of bad situations were happening. But after 7 days, God knows, God made a miracle, or God came to his support, that on the 7th day night he suddenly stood himself in bed. He was talking the next day, and suddenly the medications and the IBP, what I told you, equipment was removed on the second after 8th day, on the 8th day, and he was very happy, and we went home on the 10th day. So this was miraculous because doctor can't do everything. As I said, we are also human beings.
Yeah.
Because everyone has their hopes, but hope has also timeline.
Yeah. So
you
how
can't
many
hope
minutes?
for the years.
Right. So that person, the 85-year-old gentleman, he is still in a working condition and moving around.
Yeah, he is in follow-up.
Wow. Okay. So do you get to see such miracles on a regular basis, doctor?
Yeah, there are so many miracles. One patient which I remember just a week ago, that he undergone coronary artery bypass surgery, CABG, what we call it. And it was uneventful. Patient was not having any complaint. Patient was recovering well. On the 6th day, patient suddenly had another attack. We had to revive him from the situation where he was able to get discharged on the next day. And after revival, he again showed that intent and recovery. And then after 5 days also he went home. He is now coming with normal jolly nature and everything is very good. The heart perspective and his life perspective.
Wow.
So these are the miracles. As I said that we a dynamic thing. So we can't rest assure ourselves that the patient is okay, so he will be okay. No.
Correct.
It is just like cardiac thing. It is a dynamic, continuously moving. Anything goes wrong, anything goes right in a fraction of seconds. But that is also experience.
True. I mean, you would be seeing these miracles or non-miracles on a daily basis, and it must be daunting also. Like, how do you handle that inner pressure or that fight that you will have inside internally?
That comes with experience, madam, because as I told you, stress comes without warning. So these are the stresses.
Okay.
We have to learn to smile and learn to live life this life, because I have chosen this branch and I have chosen this field for myself, and this will remain till my life with me. So I have to be that.
Yeah.
With experience, I get more clever. That is right thing. But experience is needed. Nobody surpasses experiences.
True.
No any degree can surpass experience.
True. Now, this is quite intimidating field that you have chosen, right? There are a lot of students, MBBS students, or maybe who wants to take up MBBS as a career path, will be looking at cardiovascular surgery as a path also. Now, it is very intimidating, and you have gone through that stress yourself. So, what kind of advice you would want to give to the young people out there who are looking at it as one of the perspectives?
Yes, madam. There are so many people who are just passing out from the MS general surgery or who wanted to be a cardiothoracic and vascular surgeon comes to meet me, ask me for the same question what you asked right now. And my suggestion is very clear, because yes, it is a demanding branch, where yes, it is a tiring branch, yes, it will take a lot of out of you, a lot of life out of you, or a lot of years of your life out of you, but you need to love your branch, love what you want to do, or you want to be affectionate enough and passionate enough to take that branch and give justice to that branch till your life ends. Not just for the making money, because making money is a very transitional, temporary thing.
True.
Your motto is making money, then once you make the money, the motivation goes.
Correct.
And this is a continuous self-motivation giving branch. So everything is, it is demanding, tiring, everything, but it is rewarding. If you love, you will get better and better, and you will help humankind and every human whosoever comes across you.
Nice. That's really nice. So, if somebody wants to become a CTVS surgeon like yourself, what kind of qualities do you think? From what you said, I can say a couple of things, but beyond that, you can help me with that. Like you said, we should care. The person who intends to become a CTVS surgeon should care for the person for who the surgery is going to happen. He should care about the relatives of that person, and he should be responsible enough and be able to take decisions, be able to communicate. Beyond that, what?
First is hard working.
Okay. Yeah.
24/7 till the time you are alive. This branch requires your attention. So, not like every other branch that after getting past 70 years, you are doing surgery, so it will be easy. No, 70 years doesn't dignify that cardiac surgery will be easy for you. It is same like me, same like at the 20 years, same like 40 years, 50 years. So hard work, dedication, and continuous motivations toward your life, because with hand by hand you are having your life, having your children, having your family, having your personal life, having your own set of milestones to achieve. But hard work, I suppose, and as I always say, love what you do what you love. So that should remain.
That should be the motto.
Otherwise, the motto. Because once the achievement comes, the rest is just garbage. So you should be humble enough to get every single day an opportunity to thank God for giving you this specialty.
Amazing. So love what you do what you love. That's
what you love.
Understood. So when you are operating somebody, right, on the operation bed, you make a decision and things do not go as per what you decided. Have you ever come across such an experience? And
every day.
Okay. And then how would you change your decision right there, right then?
Because we have to go with plan A, plan B, plan C.
Okay.
We can't just go with the plan A that we will go, because it is a human body. And human body is always having some or other kind of miracles in it. It is not just like 2 eyes, 1 nose, 1 mouth, 2 ears.
Yeah.
It is much bigger inside. So many, not always, I say it always, but very frequently, more than 50-70% of times, what we want to have at that point of time is not, we don't achieve that. So we have to go for plan B. How we will treat that. That's what I told you earlier also, that we have to wise enough to take the decision on table within a seconds or minutes to what we will be able to do.
Correct.
To make these things work and make this person giving better life in the future aspect.
Okay, wow. So one more question about your personal experience itself. You have been doing so much, like fraction of second decisions and everything. Has there been any moment in your life that you felt that what you chose as your career path or your professional this thing and your contribution so far in this field, right? Have you felt anytime that this is worth all the hard work I'm doing when you were either speaking to the patient's relatives or working with the patient itself? Has been, this is what makes it worth all the hard work. Were there moments like that, and if there were, can you share something about it?
Madam, every single time whosoever the patient once admitted after getting operated, they go home with happy faces or they go home with recovery. I feel that. Till today, from my first day, I will feel that till my life ends. Because you are dealing with human and it is a talkative creature.
Correct.
Human is a talkative creature.
Correct.
They can speak, they can express, they can do anything. Machines can't do. So you get to know in real time whether it is going to work or whether it is not going to work. So as you told, I feel blessed enough. I feel great that given me this mindset, this opportunity to become this. And every single cardiac surgeon or every single CTVS or any surgeon whosoever is working for the outcome based thing or passionately towards the specialty and humankind, everybody feels the same.
Awesome.
If they are thinking like that.
Yeah. So being a heart surgeon, you have also mentored a lot of people out there, right? And I think you are really blessed, and you are also a blessing for the society. Whoever has been come in contact with you and have been taken your. So I would like you to share one message to all the people out there, like about heart health, how they need to handle it, and what they can do. Like just one message that can help them to protect themselves from any kind of heart ailment. It's like a quick thing.
Do not hesitate to get a medical checkup done, whether you are 10-year-old, 20-year-old, 30-year-old, 40-year-old. People hesitate to get done investigated just in case they come out with any abnormalities. But don't hesitate, because cardiac thing doesn't work like that. So it doesn't apply that after 40 years you get to investigate yourself. Health checkup should be done at the age of after 40. No. If you are feeling uncomfortable regarding anything from neurological, cardiac, urological, plastic surgical, lower limb, upper limb, whatever, get investigated.
Earlier.
Consult any specialist. Find proper person, find proper doctor, and then get consulted.
Understood. Before leaving, one last question. It's a personal question. So, how do you balance your family life and your professional life in all this?
My family balances me. I don't balance.
Okay. Okay.
So, as I said, all are doctors and they are understanding enough and kind enough towards me that, and they know also that this branch takes a lot out of you in terms of mindset, dedication, efforts, years. But I'm lucky enough, as I said, in my education journey, my personal parenthood journey, or my parents' journey, or my family life, personal life journey, that I'm having that kind people around me.
Okay.
They understand me well. They understand my work profile as well. So yes, it is difficult at times. There are times where you need to take your own decisions that you are prioritizing patients over family. But still,
it's part of your journey.
It is part of our life, and everybody understands. And understanding is the key for any family.
True. That's so beautifully said. Thank you so much, Doctor, for sharing all your insights, all your journey. And this is really very, very opening and very insightful it was. Thank you so much, Dr. Parth. I'm wishing we'll have one more conversation extending to this, but I know we have already surpassed more than an hour in this conversation, and I don't want to hold you back because you'll have your lot of work around. So again, thank you so much. It was really kind of you, and I would look forward to one more conversation of ours. Thank you so much, Doctor.
Sure, madam. We will again reconnect with better questions and better understandings.
Yes.
Sure, madam.
Sure. Thank you, Doctor.